A 29-year-old woman arrives at the emergency department with sudden, sharp lower abdominal pain. She describes the pain as severe, stabbing, and located mostly on the right side. It began abruptly a few hours ago and has been getting progressively worse. She looks pale, anxious, and is moving slowly because every step increases her discomfort. She reports that her last menstrual period was about 6 weeks ago, and she has had irregular cycles for the last few months. She mentions having mild spotting for the past 2 days, but she assumed it was just an early period. She also notes nausea and breast tenderness over the last week, symptoms she thought might be due to stress. On arrival, her vital signs are concerning. Her blood pressure is 92/58, heart rate is 118, and she appears lightheaded when she sits up. Her skin is cool and clammy, suggesting early hemodynamic instability. On abdominal exam, there is significant tenderness in the right lower quadrant in suprapubic area, with guarding. A gentle pelvic exam reveals cervical motion tenderness and increased pain on the right adnexa. A urine pregnancy test is positive. Her beta-HCG level is elevated but lower than expected for a 6-week pregnancy. This raises suspicion of a non-viable or abnormally implanted pregnancy. A stat transvaginal ultrasound is performed. The uterus is empty. No intrauterine gestational sac is visible. However, a complex adnexal mass is seen in the right fallopian tube, along with free fluid in the pelvis, suggesting bleeding. Given her symptoms, unstable vital signs, positive pregnancy test, absent intrauterine pregnancy, and the presence of free fluid, the diagnosis is an ectopic pregnancy, most likely a ruptured right tubal ectopic. Ectopic pregnancy occurs when a fertilized egg implants outside the uterine cavity, most commonly in the fallopian tube. As it grows, it stretches and eventually ruptures the tube, causing internal bleeding, a life-threatening emergency. This patient requires urgent surgical intervention, typically a laparoscopic salpingectomy or salpingostomy, depending on the extent of damage and bleeding. She should also receive intravenous fluids, blood products if needed, and close hemodynamic monitoring. Key takeaway: abdominal pain, amenorrhea, vaginal spotting, positive pregnancy test, empty uterus on ultrasound, and an adnexal mass are classic signs of ectopic pregnancy. Early recognition saves lives, especially when rupture and internal bleeding occur.